or APOE4. Researchers have shown that the risk of developing Alzheimer's disease increases for patients that inherit one E4 allele, and increases even more for patients who inherited two E4 alleles, one from each parent. Apolipoprotein E helps break down beta amyloid, but the E4 allele seems to be less effective than the other alleles, like the APOE2 allele, meaning patients are more likely to develop beta amyloid plaques. Familial Alzheimer's disease, on the other hand, is used to describe cases where some dominant gene was inherited that speeds up the progression of the disease, so sometimes familial Alzheimer's disease is referred to as early onset Alzheimer's. Familial accounts for about 5 to 10% of cases, and can be caused by several gene mutations. First, mutations in the PSEN1 or PSEN2 genes on chromosome 14 or chromosome 1, respectively, have been linked to early onset Alzheimer's. These genes encode for presenilin 1 and presenilin 2, both protein subunits of gamma secretase. Mutations in these PSEN1 or PSEN2 genes can change the location where gamma secretase chops APP, producing different length beta amyloid molecules, which seem to be better at clumping up and forming plaques. Another known genetic cause of Alzheimer's is trisomy 21, or Down syndrome, which involves an extra copy of chromosome 21. It turns out that the gene responsible for producing APP is located on chromosome 21, which means that people with Down syndrome have an extra APP gene, and presumably increased expression of APP, potentially increasing the amount of amyloid plaque buildup. For this reason, familial Alzheimer's disease often progresses by age 40 in patients with Down syndrome. Symptoms of Alzheimer's disease worsens as plaques and tangles build up, and damage to the neurons accumulates. In the early stages, symptoms might not even be detectable. As it progresses, though, patients lose short-term memory, like, for example, they might not be able to remember what they had for breakfast that morning. They then progress to loss of motor skills, making things like eating difficult without help. Also, language becomes affected, making it more difficult to communicate. Eventually, they lose long-term memory, like forgetting the name of their spouse or even that they're married in the first place. And they progressively become more disoriented, which can be dangerous because they might wander from home and get lost. In the late stages, they become bedridden, and the most common cause of death is actually infection, like pneumonia. Diagnosis of Alzheimer's disease is really tough because the only way to definitively show that a person had Alzheimer's is by performing a brain biopsy after autopsy. Usually, a clinician will therefore make a diagnosis after excluding other causes of dementia. Currently, there isn't any cure for Alzheimer's disease. Some medications exist, but the benefits are small, and there haven't been any medications that clearly and definitively halt the progression of Alzheimer's. Thanks for watching. You can help support us by donating on Patreon, or subscribing to our channel, or telling your friends about us on social media.